So for sinuses, your projections are going to be PA Caldwell, Waters, lateral, and SMB. When you first start off, you would go by getting your patient, introduce yourself with your name and that you're an LIT radiology student. You would verify the patient by checking the wristband, asking for date of birth and full name. When you take them to the room, you would then take them to the room, ask them for history questions, which include any drainage, injury, or surgery to the facial area, and pain. Make sure to ask LMP, and then you would prep your patient, which includes removing any dental work that's removable, any bobby pins, any earrings, necklaces, anything like that. Whenever you start off with the PA Caldwell, you want to make sure you put the cassette into the wall bucky. Make sure that your tube is detented 40 SID and that it's angled 23 degrees caudate. You want to have your patient face the board. For the wall bucky, you have to move the wall bucky and the tube and make sure it's always centered because it will not move on its own. So you would have the patient face the board, make sure their nose and their forehead is touching the board. You want to make sure your OML is perpendicular. You want to exit at nasion and midline, and you want to make sure whenever you do that, you want to go around the patient, like behind him, and make sure that there's no tilt or rotation. Once you do that, you would mark either left or right. Make sure your patient is shielded for all of these projections, and don't breathe, don't move. For the next one, it's going to be Waters. So you would take off the angle, make sure your tube is still the 40 SID, it's no angle, and then make sure that you move your wall bucky or your tube, whichever one, to make sure it's always centered. You would have them extend their chin and make sure that MML is perpendicular at all times. So whenever you do this one, we do it open mouth, so whenever you do that, you want to exit at Canthion, but still exit at Canthion and midline. So when you go around them, you would make sure that the MML is perpendicular, have them open just their lower mandible so that your MML is still perpendicular. You would stand behind them, make sure that they're still straight and midline, no rotation, no tilt. You would have them shielded, make sure it's your bucky centered, shield left or right. I'm sorry, mark left or right. Don't breathe, don't move, and make your exposure. Next one is going to be lateral. For lateral, you don't want to have a great OID or between you, the board, and the object. So you would do LAO. You oblique them for a lateral, like LAO. And so you would have them face either way, whichever side of the face is hurting. So you would have them face that way, make sure your tube is still detented, it's still 40 SID, no angle. Again, always make sure to move the bucky with the tube so it's always centered. You would still the same collimation. Marker's always going to go in front of the light field. You want to center between the outer canthus and your EAM, but not too much to where it's like in between your cheekbone. So make sure you're always shielded, 5x5, 40 SID. Make sure you're centered correctly. Want to make sure you want to stand in front of the patient, make sure their IPL is perpendicular because they usually tend to tilt towards the board whenever they're facing that way. So you want to kind of move their head to where your IPL is perpendicular and there's no tilt or rotation. After you do that, don't breathe, don't move, make your exposure. Last one is going to be SMB. You want to extend the neck all the way back, making sure that the top of their head is touching the board. You want to make sure that your IOML is parallel to the board. And for centering, it's going to be between the gonion, and you still want to have 40 SID, making sure that you move your wall bucky or your tube to have it angled. I'm sorry, to have it centered. So you center 40 SID, always shield your patient, synchronization, and you would stand in front of the patient. Again, make sure that their head is straight, no tilt, no rotation. Making sure your IOML is always parallel. And once you have that, you would make your exposure. Don't breathe, don't move.